Hi, I'm Dr. Brian Gray. I'm the Chief Clinical Officer at Candid Pro Clear Aligner System. Here to talk to you a little bit about patient expectations. One of the things that we like to do in dentistry is try and always underpromise and overperform. The idea being behind that we'd like to have patients that are satisfied and happy with their results. Well, I want to share a little saying that I got from a buddy years ago that still sticks with me. And I want to share it with you because it represents the essence of clear aligner therapy. And that is expectations minus reality equals disappointment. Meaning, simply, if we don't tell the patient about everything that possibly could go on and be sure that they understand it, it can come back to haunt us in the form of them not being satisfied with the result that we wanted to provide. Even if we think it's optimal, even if it's biomechanically the best that we can achieve, it's important for the patient to have realistic expectations before we start. So the way we do that in our practice is through informed consent. And there are 7 things that we always want our patients to know, not before we start treatment, but before we even get records. We make sure that we cover these things with the patients so that they understand it has, on occasion, saved me from even getting records because the patient's like, I didn't realize that. Now that I know, I think maybe I'll pass on doing the ortho right now. I've got a lot going on in my life. This doesn't fit, whatever it might be. So let's cover those 7 things and how we present them to a patient to see that they make sure they understand exactly what is expected of them and what is expected of us to have success so that in the end we end up with a beautiful case. First and foremost, with any clear aligner system and any removable orthodontic system, key to success is having it in the mouth. I always say the patient can have it in their mouth or they can have it in their pocket. If it's in their mouth, if it's working, if it's in their pocket, obviously it's not. And the difference between fixed and removable ortho is that fixed is on your teeth 24 hours a day. One of the only advantages that fixed has over removable ortho is that fixed can't go anywhere but on your teeth unless you break a bracket or something like that. So first and foremost, the number one thing we talk about is compliance. You need to have aligners in your mouth 22 hours a day, and you take them out for 3 things: eat, drink, and clean. Otherwise, they got to be in your mouth or they're not working. Now, all our protocols with Candid are built on wearing them less than that. There's a different lecture for this at a different time to talk about the actual numbers. But I like to say, if you tell a patient that they can wear the aligners 20 hours a day, they're probably going to wear them 16. So if you tell a patient that they need to wear them 22 hours a day, they're going to get that that means full time, and they can only take them out for the eat, drink, clean thing. Otherwise, they got to be in their mouth. If, again, you say 22 hours a day, you might actually be getting 20, which is still going to be fine for us. It's going to be inside that amount of time that we talked about necessary to have success, even with doing it as weekly change. So the first thing we talk about is compliance, 22 hours a day in the mouth, and we want to be sure that they're understanding that that means they can't do it for 2 days and take a 2-day off or something like that. It's got to be consistent. Done that one. The second thing we talk about is attachments. It's amazing how attachments have changed. They went from 2 types, round and square, basically, way back in 1999 and 2000, to 6, then 12, and then an infinite different type and size of attachments, where it got so complicated and silly that it was obvious that it wasn't nearly as efficient as we wanted it to be. I want patients to be aware of attachments and how they work. I like to say it's like the handle on a teacup, and it's necessary sometimes for us to create a moment arm, a force to help drive a tooth around to move it in the proper position, or occasionally to act as a retentive element. The beauty of Candid is that we don't need attachments for retentive elements because we've got such great retention interproximally where it locks into the teeth without resting on the gums. Very important. It's on the teeth, not the gums. So we talk about attachments and actually want the patients to touch and feel them. I'll get out my Candid Typodont model. I'll put it in their hand. I'll say, feel this little bump, this little attachment on the side of the tooth. That's what you may have on your teeth. Now, the next question is always the same. It's, really, doc? How many? Where? And my response is always the same. I'm like, let me do some computer modeling. I'm going to put those attachments on as small as and inconspicuous as possible, as few as possible for as short a period as possible. And they're like, oh, great, thanks, doc. Now, in essence, I'm not really doing anything. I'm just using the protocols that I have put in place in my prescription and my preferences for attachments to be automatically placed for treatment itself. Mine are super conservative. Nice thing is, my old system, we were averaging 13 attachments per aligner. I'm sorry, per case, 6.5 per arch, so 13 total. And that was just way too much. That was average, by the way. There were some simple cases where we had less, and others were putting attachments on molars and silly things that we knew were not really providing any true support. But I still want patients to be aware of them. So I have them touch and feel them, because the last thing I want to do is have the patient back in the chair at the delivery, me be putting these attachments on, have the patient say, stop, wait, what are you doing? What is this little bump on my tooth? And that's where we have to explain it. So we talk to patients about attachments. By the way, doctor, there's a difference between attachments and buttons. Buttons are a little preformed thing that we glue on the teeth. Attachments are a blob of composite that we place on the teeth with a template. So we make sure that the patients are aware of compliance, attachments. Number 3 is IPR, interproximal reduction. We've got a great little video. You can learn a little bit about IPR, but it may be necessary. And we use gentle terms like smoothing, contouring, polishing between the teeth to help create the right space and give the patient a beautiful smile. If it's a spacing case, I don't have to talk about IPR, but otherwise I will. The fourth thing that we're going to talk about is monitoring. Monitoring is something that's really cool and unique to Candid. It's the only system that has an FDA-approved monitoring system for ortho built into it that we use to guarantee that the teeth are moving the way we want to by using AI to see that the aligners are fitting properly. We want to make sure patients are aware of this wonderful feature that normally costs anywhere from $300 to $500 with other systems as an extra. And it's built in, and it's already been designed to work in our practice, so I don't have to have an extra employee. I don't have to have extra workflow built in. The Candid monitoring, pro monitoring system is fantastic for its ease of use and intuitive nature. But we want to make sure our patients know, and as you would figure, our patients that are old may struggle a little bit with using something scanning and technology based, and our young patients obviously pick it up right away. Either way, if they use it, it's going to make treatment super easy for us. Let's go through it now. We've got compliance, we've got attachments, we've got IPR, we've got monitoring. Number 5 is refinement. Refinement is the ability for us to get extra aligners to tweak the case when we're all done. I want to be sure that the patient knows that, because when I'm done with my cases, pretty much almost always I get a few aligners for refinement to make sure I've got it zeroed in that the bite is perfect. It doesn't cost me anything extra, but it's a wonderful benefit I can provide my patients to give them a really, really great stable result. Now, the reason this is important is because your patient gets this beautiful box from Candid that says, you have 17 aligners, you're on number 3 of 17, right? And they go through their aligners and they get to 17, and they're like, great, I'm all done. And you're like, no, you're not done. We're going to get a few extra just to tweak it in. That is where I want to make sure, again, I've created excitement and not disappointment. And I usually say to the patient, again, this is to make sure we tweak the case and get it perfect. But remember, this is what we shared before we even started, that the number on that box is not actually maybe the total number. I may get a few extras. By doing that, I set myself up for success. It makes the patients, in their eyes, look at me like I'm really going the extra mile to be sure that their case is perfect. And by doing this, I know I'll have great stability down the road. So now we've got number 1, compliance, 2, attachments, 3, IPR, 4, monitoring, 5, refinement, 6 is going to be occlusal adjustment or equilibration. When I'm done with my cases, I will oftentimes adjust the bite. It may mean something as little as polishing with a Burlue wheel, or a full major equilibration where I have to do not just subtractive where I polish down, but additive where I may put some bonding in place to help make sure the bite is stable and going to stay that way. I like to challenge people by saying, if teeth match in a bad bite and you move the teeth, how can they match? Answer is they can't. Think three-dimensional biomechanics, and you understand that you have to do sometimes a little bit to get that bite to stay that way because the patient's worn the teeth into those positions. Now, you may or may not do an occlusal equilibration or adjusting the bite. That's okay. But that same spot, that number 6 spot, can be used to talk about restorative as well. Maybe you're going to do some enamelplasty and polish some rough or sharp edges. Maybe you're planning on doing veneers or doing a little bit of bonding on some small laterals when you're all done. Maybe it's move the teeth into the best position and replace that ugly old gold crown that has a hole in it on number 19 to give them a much better smile. And the reason we do it after than before is because now I can make it fit that beautiful, perfect bite. So let's go through it again. We've got compliance, attachments, IPR, monitoring, refinement, occlusal equilibration or adjustment, and the last and most important one, retention. Number 7 on that list is retention. Used to be that was kind of questionable when we would do retention for patients and how long, and it's pretty much solid at this point. Maybe 20 years ago it was an issue, but now we know that retention is for life. I immediately share with patients that our bodies are constantly changing, and I use myself as an example. I can poke fun at myself and say, hey, this hair used to be a different color. Now it's, salt and pepper or turning white or whatever. And I need reading glasses, and my skin's a little bit saggy and my muscles have moved to my gut, etc. Our bodies are always changing. They're always shifting and breaking down. We need to have some good, solid retention to keep them in the proper position so they don't shift around, so that the teeth stay. And it should be just a gentle reminder. When a patient puts a retainer in, it should be passive. It shouldn't be tight. So if you have a patient that puts in a retainer and every night it's tight, and every morning they take it out and their bite feels different, it means that the case isn't completed, that there's still stuff that's trying to get into a better position. All day it goes try to get in that position, and all night we push it back into a different one. So we, at that point, want to make sure that those things are equal and comfortable. If we do, and we put in the right retention that's acting as just a simple reminder, our patient's going to have something that they're going to be encouraged to wear, especially if it's the Permaform system where we can use it to keep the teeth straight and use them as whitening trays so they can bleach their teeth a little bit on occasion to give them that nice, pretty, bright, bling smile that we like so much. Following those 7 steps, and having done that at the very, very beginning, before we've even taken records at the consultation appointment, is a great opportunity for us to set realistic expectations for our patients so that we underpromise and overperform and give them that smile that they've always, always been looking for. Thanks.